Beeps and alarms in hospitals are designed to help keep patients alive, but what if doctors and nurses couldn't hear them? It's a problem you might not know exists. News 4's Jen Shantz joins us live with how research teams are fighting so-called alarm masking. Jen?
Well, Melina, the concept here is pretty simple. Our brains can only decode so many different sounds at a time. When the airwaves get clogged, certain noises have the ability to cancel each other out. No big deal, right? Well, when you're dealing with a code blue or another medical emergency, you need to be able to hear everything. A team at UB has developed a new tool that could get ahead of this problem.
And then we have the third alarm.
Dr. Matthew Bolton is developing a computer-based tool that uses the same technology as MP3 audio files. The goal?
When critical alarms go off, people will be able to hear them.
With the help of a grant from the U.S. Department of Health and Human Services, Bolton is working to combat a symptom of overstimulation in hospitals, missing important sounds.
You can have multiple sounds coming into the human ear at any given time, and our ear can only encode a certain amount of information at any given frequency.
He's enlisted the help of Scott Erdley, a simulation education specialist and a nurse. Erdley, who's spent years in hospitals, says alarm masking is becoming a real issue.
It's becoming more and more a problem. As the electronics proliferate and become more common, the chances increase that you're going to have that masking.
According to the Joint Commission, between 2010 and 2016, there were 260 alarm-related events, which could mean anything from incorrect settings to policies not in place or an alarm not being heard. The events impacted 264 patients and caused 193 deaths.
Within the confines of, say, an operating room, you're going to have multiple alarms from the monitors, from the patient, from the ventilator, from the pumps. You could probably have maybe 13, 14 different noises going at once.
Dr. Bolton is a human factors engineer. He works to make machines better, knowing humans operate them. Understanding innate human limitations, he says, will make hospital technology safer.
If the person can't physically hear the alarm, they're not going to be able to respond to it. And so this work is meant to provide that check.
Now, alarm-related flaws caused, on average, according to the Joint Commission, about 32 deaths a year between 2010 and 2016. Medical errors in general, though, are a leading cause of hospital-related deaths. Dr. Bolton's goal here is to streamline how doctors and nurses respond to emergencies and make the process better. In fact, the International Medical Alarm Standard is currently being revised to achieve just that. One of the problems researchers there are looking into? May have guessed it, alarm masking. Live in the newsroom tonight, Jen Shantz, News 4 at 5:30. Melina?
It's a fascinating report, Jen.